You may know some of the services TriCap offers, but did you know they also offer family planning? We're going to find out about that in this edition of WJTS in.form. I'm your host, Bill Potter. Joining me in the studio is Deb Capps. She is the Health Services Director, amongst other things, at TriCap. Also joining us is Dr. Rachelle Sherer, and she is the TriCap family planning physician. Welcome to both of you to the show.
Thank you for having us.
Well, Deb, we're going to start with you. You are the Health Services Director for TriCap.
Correct.
But you do wear many hats. You do four things total.
I have 4 programs that I'm very involved with, one of which is family planning. I also do some healthcare navigation, helping people to get on health insurance. We have a breast cancer program for low-income people who have been diagnosed with breast cancer to help pay for their treatment expenses. And then I'm very involved with Du Bois County Cares, which is a substance prevention effort here in Du Bois County.
Yeah, and TriCap offers 100 million different services.
Maybe not
You're
quite
just
that
those,
many, but a bunch.
Yes, it is.
It is
but
a
just
lot.
the 4 that you're involved in are very important. And we're going to talk about family planning today. Tell me about that.
Well, we've had a family planning clinic here in Jasper and in Evansville for probably 20 years. And we offer the entire range that a gynecologist would offer. So women's annual exams, helping them with their birth control options, STD testing, we offer that to men as well. So men can come in for that. Treatment, if they do test positive for an STD. We also test for HIV as well. And so we have a clinic here in Jasper at our TriCap office on 3rd Street that's open Mondays 10 to 6, Tuesdays 8 to 4, and Thursdays 8 to 4. So, and people can come in and see Dr. Rochelle herself. And we're very excited to have a physician on staff. Before, we've always just had nurse practitioners, which they're great, but now we have an experienced physician, and she has just been a lightning rod for our clinic.
Deb, talk, if you could, about the demographics of who comes in for family planning at TriCap. Is it mostly women, age range maybe, or is it couples? How does that work?
Well, it is mostly women, but we do see men as well for the STD clinic. We see anybody who's of reproductive age. So a young girl who has started her cycles, she could come in. And we do have young teenagers that come in who are not sexually active, but who are having problems with their menstrual cycles. We also have some teenagers who are sexually active that come in. But by and large, most of our clients fall in that 30 age range. 30s to 40s is where our biggest clientele are right now.
Okay, and now we're going to turn to you, Dr. Rochelle. If you could talk a little bit about what, you're a doctor, they're coming in to see a doctor. I wouldn't think about going to TriCap to see a doctor, but they're coming to see you. What, do you counsel with them? How does that work?
It's just like a regular health clinic. They come in and I take a very detailed history. And once a year they'll have an annual exam. And if they are not 21 years of age, just listening to the heart and lungs and whatnot, but when they get older, they'll have their pap smear every 3 years and a breast exam, which will become every year once they're 40. So we'll do the regular examination. I do a lot of counseling. Probably the majority of what I do is counseling and helping women decide what form of birth control they want to use, helping them with risk reduction on how to not get a sexually transmitted infection. And then if they do test positive or come in with symptoms, diagnosing what they have and then treating it.
When we think of family planning, birth control pills is probably what everybody thinks of, but there are natural means of doing it. There are other means. Can you talk about that a little bit?
Absolutely.
I see you've brought some samples.
I did. We have quite a range that we offer at TriCap. I'm really excited about the long-acting reversible contraceptives, or the LARCs. These have a efficacy rate that even surpasses having a tubal ligation. So, women think, oh, I have to go have my tubes tied when I'm done having a family, and that's a surgical procedure. And we offer these other options that are even more effective, have a better efficacy rate than the surgery here in the office. And we offer 3 different types. Currently on the market, the most effective form of birth control is the Nexplanon, which is this implant. And it's just a little flexible rod that looks like this. It's white though, and it's inserted with a large gauge needle into the arm, underside of the arm, and you can't see it in the arm, but you can feel it. So this, we let the patients feel
Okay,
what
would
it
be
feels
the arm.
like. That's the arm.
Okay.
So this releases a progesterone type of hormone, and it lasts for 3 years. And the efficacy rate, there's less than a 1%. It's a 0.05% risk of getting pregnant with this. So it is fantastic. So people who have difficulty remembering to take a pill or remembering even to come in to get a shot, this is a very effective way of birth control. So we offer the Nexplanon, and I can put one of these in less than 27 seconds. It takes more time to counsel the client and to consent for it than it takes to actually put it in. And the only discomfort they feel is numbing. I numb the area up and then we put it in. No stitches, a little steri strip, wrap it up, and they're good to go. Then the other two long-acting reversible contraceptives that we offer are the IUDs, or the intrauterine devices. And this here is the Paragard, which is a copper IUD. It has no hormones. So women who don't want to be taking hormones either because they have adverse side effects or headaches or whatnot, they can go with something that's hormone-free. And this goes up inside of the uterus, and I put them in the office, and it lasts for 12 years. Okay, and the failure rate for this is 0.8%. So it is fantastic. Yeah, it's pretty comparable to having your tubes tied. This here is the Liletta, which is similar to Mirena, and it is similar to the Paragard IUD. And this has been around since the late 70s, early 80s. Okay, this here has a small little silicone tube on the inside that releases a small amount of progesterone, which is similar to what is in the Nexplanon or in the Depo-Provera shot. And this allows for the woman, it will thin the lining of the uterus here so that they don't have heavy bleeding. And a lot of women who have this will stop having periods altogether. So this is effective for 5 years. So these are lovely options of birth control where it's long acting but it's reversible. Let's say they get 4 years into it and decide that they want to have another baby. We can remove it and they can go back to having a regular cycle and getting pregnant. Okay, so we offer the long acting ones, but then we also offer the standard birth control and pills, and we have multiple different strengths of pills in the office that we provide the clients, and we give it to them at the appointment. And we have some low level ones, some medium strength ones. We have ones that last seasonique here. This is a continuous cycle that they take for 3 months, a pill every day for 3 months. And then the last 13th week is the sugar pill week that they will have a period. So with this, they basically only have 4 cycles a year or 1 period a season, hence the name Seasonique. So it's a long-acting form. We do offer the Depo-Provera shots, which is the birth control injection that's progesterone only. It's an injection they get every 3 months, so 4 times a year. They'll come into the clinic and we give the Depo-Provera shot. And then we do offer natural family planning methods. If someone doesn't want to go on any hormones, we have natural methods, and we have these cycle beads we offer that allows the woman to track when they start their period, and then they move the ring every day after that, once a day. And when they're in the brown bead area, they're safe. And when they're in the white bead area, they need to use precaution, whether it's condoms, and we do offer condoms at the clinic, whether it's condoms or abstinence, but they'll do something during that time, and then back to here, they're in the safe zone as well. So we offer many different options for our clients.
And really, it's a matter of sitting down with you and talking with you to find out.
Well, to find out their health history, because some conditions they may have may contraindicate some forms, or favor another. A lot of times it's finding out personal preferences or lifestyle. If someone can't remember to take a pill every day, well then you wouldn't want to prescribe a pill because it won't be effective. So, and we help a lot of these people who maybe don't want to have a baby for 5 years, and so we'll go with more of the long-acting reversible contraceptives.
And this is, when we say clinic, sometimes clinic can mean, like a meeting room or something, but we're talking about a clinic.
Oh yes, it's
Is
an
that
actual
TriCap?
doctor's
Yeah.
exam office with the exam table and everything else. It would look just like any other gynecology office.
How does somebody pay for this, or who qualifies to go to TriCap to talk with you?
Anybody can come for this so long as they're of reproductive age. And we do have clients who have great insurance and could go absolutely anywhere, but they've been coming here since their 20s, and they like it because they can call in on a Monday and possibly be seen that very same week. And most cases with a doctor, you call in on a Monday, you may not be seen for a month. But we take all forms of insurance, and we use a sliding fee scale. So many of our clients are a zero pay or a 25% pay. So when you look at these options, the Nexplanon that goes in the arm, that device itself is $399. Someone can come in, get a Nexplanon, get a pap smear, be counseled with Dr. Rochelle. The whole thing, that appointment will probably cost us around $1,000 for that client, but we have a grant that helps pay for their expenses. So if they can't afford it, that's no problem for us. We welcome anybody of any nationality to come in and be protected against an unwanted pregnancy.
Do you find many of these patients don't have a doctor?
Yes.
And
Yeah.
so, and this, you may be the only doctor they see.
I've had
for
some
years.
patients come in, they haven't seen a patient or a physician for 7 years. So, yeah.
Yeah, and that's very common, that clients who don't have insurance or don't have the means to pay can't get it anywhere else, but they can get it at TriCap Family Planning, and we're happy to have them. We accept donations, so a client who comes in and gets $1,000 worth of services might give us, a $5 donation. For us, that's huge. We appreciate that, because that $5 for them may be equivalent to what $50 would be for me, or $500 for somebody else. So we're really appreciative when a client appreciates what we're doing so much that they give us a donation.
I guess now to wrap it up, the call to action, do they just call the regular TriCap number, or is there a special number? Do they need to go through a special door? How does any of that work?
Good questions. The number to call would be 812-482-2233, extension 144, or just ask for Sandy. And we do have our own door. So if you're familiar with the TriCap building, the main entrance for TriCap on 3rd Street is to the left side of the building. But on the far right side of our building, closer to where Dollar General is, we have our family planning entrance, and that's where our clients would come in. So it's very private, very confidential. People will not. If you run into the main office, you might see all kinds of people but you come into the family planning office, and it is a very private. And we schedule our clients so that typically we only have one client in the building at a time, and we designate that usually about an hour for that client alone, so that they get in, they fill out any paperwork, they're immediately with the nurse, then they're immediately with Dr. Rochelle. She takes care of them from there on out until they are smiling and walking out the door.
Well, thanks, ladies, for coming in and talking about this.
Thank you very much for having us, Bill.
We have had as our guest Dr. Rachelle Sherer. She is the TriCap Family Planning Physician, also Deb Capps, who is the Health Services Director and other things at TriCap. Thanks, ladies, for being in. Thank you for watching 18 WJTS in Form. We are local people watching local people.